Hello everyone. Today we'll be talking about antenatal care. So antenatal care it basically refers to a systematic supervision which consists of examination and advice of a woman during pregnancy. This is what we call antenatal care or prenatal care, okay? So what are the aims of antenatal care? Basically what you want is why is antenatal care important? So this is done to screen the high-risk cases, to prevent or to detect and treat at the earliest any complications that may arise during the pregnancy, which may be as a result of the pregnancy or may not be as a result of pregnancy, to ensure continued risk assessment and to provide ongoing primary preventive health care, to educate the mother about the physiology of pregnancy and labor by aims of demonstration, charts, and diagrams. Because there's so many physiological changes that occur in pregnancy, a mother might be confused. She's like, is this normal? Is this not normal? So that's one of the aims of antenatal care, to reassure the mother when something happens that is just a physiological change. To discuss with the couple about the place, time, and mode of delivery, provisionally and care of the newborn. Also to motivate the couple about the need of family planning and also appropriate advice to couples seeking medical termination of pregnancy. So before we get to anything abnormal, remember we said our aim is to assess how the pregnancy is progressing. So we need to know what is a normal pregnancy. So this refers to delivery of a single baby in good condition at term. So term is usually between 38 to 42 weeks gestation with fetal weight of 2.5 kg or more and with no maternal complications. So as such, so the diagnosis of a normal pregnancy is a retrospective term. So you cannot, so during a pregnancy, you cannot say this was a normal pregnancy. You can only say it after the delivery has happened, right? So it's a retrospective term. So what are the components of antenatal care? They include history, examination, investigations, okay? So under history, what are we interested in? So we're interested in demographics. Demographics consist of the name, the current date, the age, the gravidity of the mother, the parity, gestation, age, occupation. So when we refer to gravidity, this simply refers to the number of times the mother has conceived a pregnancy, okay? It has nothing to do with the gestation age. So basically the number of times a female has been pregnant before. Parity, this refers to the number of times the fetus has reached the age of viability. That is the age at which a fetus is able to survive outside the intrauterine environment, right? So this age varies. So in some countries it's 20 weeks, in other countries it's 24 weeks. Okay. Gestation age, this basically refers to how many weeks the pregnancy is. Occupation, what does the patient do? Then we go to presenting complaint. Does the patient have any complaint? Then we're interested in history of present pregnancy. Then obstetric history. Menstrual history, past medical and surgical history, family history, social history, and a summary. So basically the important aspect here is obstetric history. So what are you interested in? You're interested in the status of gravidity, the parity, the number of previous deliveries, have they been term, preterm, any miscarriages, any history of termination of pregnancy. Currently, how are the patient's social conditions? Okay. Then under menstrual history, we're interested in the cycle, the duration, the amount of blood flow. So why is menstrual history important? So it's important in dating of the pregnancy because we usually use the last normal menstrual period. However, if patient has been having irregular periods, we cannot use the menstrual history to date the pregnancy, okay? So under summary, what is important? So basically what is most important is the obstetric history. Okay, so we usually include the name of the patient, the gestation age, the gravidity, the parity, any presenting complaints. If they're there, then the history of presenting complaints. Okay. Yes, and one more important thing was we also need to include the contraceptive history. Okay, history of contraceptive use. Then we go to examination. So we have to do a general physical examination, which would look at the height, the weight, any pallor, jaundice, edema, and the vital signs. So we look at the height. So why is height important? So if the patient has a short stature, it's likely to be associated with a small pelvis, okay? Then weight. Why is weight important? So repeated weight checking is in subsequent visit, it's preferably done in the same weighing machine. So because I don't know if you have heard about preeclampsia, that these conditions where there's excessive weight gain, okay? So that's why we need to check the current weight, and then we need to be checking the weight in subsequent visits to check if the weight is adequate, if it's inadequate, if it's over, we need to investigate the cause, okay? And then we do a systemic examination, which is basically examination of the respiratory system, cardiovascular system, GIT, central nervous system. Then we need to do an obstetric examination, okay? So an obstetric examination, we look at the abdomen, we check the tone of the abdominal muscles, if there's presence of any incisional scar or presence of herniation and skin conditions. Then we can use the Leopold's maneuver in the obstetric examination, okay, where there are 4 grips. So we have the fundal grip, lateral grip, first pelvic grip, and second pelvic grip, okay? So if you want me to explain more on the obstetric examination, I can make a separate video on that. Then vaginal examination. This is not commonly done. Then we go to investigations. Yeah, and why vaginal examinations are not commonly done? It's usually, especially later in the pregnancy, it's due to the risk of infections, okay, introduction of infections. So that's how it's not very commonly done. So investigations. So under blood investigation, we do a full blood count. So in the full blood count, we're interested in the hemoglobin, hematocrit. Then we also need to check the ABO and rhesus blood group. VDRL, this is basically testing for syphilis. And we need to do a urinalysis to check for the presence of any leukocytes in urine, which may be due to a UTI. We need to check the presence of proteins, presence of blood in urine. Then we do serological tests for rubella, hepatitis B, HIV. Then we do maternal serum alpha fetoprotein and ultrasound examination. So why do we do a serum alpha protein test? This is usually done at 15 to 18 weeks. In the mother, this is done in mothers that are at risk of carrying a fetus with neural tube defects, okay? So we're able to assess for Down syndrome or other chromosomal abnormalities. Then under the ultrasound scan, we can do a transabdominal scan or a transvaginal ultrasound scan. So why it's done? It's done to detect early pregnancy, for accurate dating, and only an early ultrasound scan is used for accurate dating, okay? So a first trimester scan. To assess the number of fetuses, to check for any gross fetal anomaly, to check for any uterine or adnexal pathology, okay? So how many antenatal visits? So ideally, this should be more flexible depending on the need and the convenience of the patient. So in the developing countries, as per WHO recommendation, the visit may be curtailed to at least 4. So first in the second trimester around 16 weeks, second between 24 to 28 weeks, the third visit at 32 weeks, and the fourth visit at 36 weeks. So when we talk about this, how many antenatal visits? So this was previously, they did this. However, some countries are still following it. However, other countries have gone to a minimum of 8 visits now, whereby there should be 1 visit in the first trimester, 2 to 3 visits in the second trimester, and 4 to 5 visits in the third trimester. So this is basically explaining one of the objectives of ultrasound scan. So to assess fetal well-being, to check the lie, the presentation, position, and number of fetuses. Then to organize specialist antenatal clinics for patients with problems like cardiac disease and diabetes. to select time for ultrasonography, amniocentesis, or chorionic villus sampling when indicated. So these are basically objectives of antenatal screening, okay? So all this investigation that we just discussed, these are why they're done, okay? This is for the ultrasound, this is where we do a full blood count. Urinalysis can help with diagnosis of preeclampsia, okay? So the above things that we talked about, that is what is commonly done in the booking visit. So what happens in subsequent visits? So we do the usual, we do a history, examination, abdominal examination, and vaginal examination, depending on if it is indicated, otherwise not necessary. So once a patient comes for antenatal clinic, we need to give the patient antenatal advice, okay? So a patient needs to ensure they rest and sleep adequately so they can continue with their usual activities throughout pregnancy. However, they need to avoid excessive and strenuous work, especially in the first trimester and in the last trimester, okay? And in the last trimester, that is to about almost the last 4 weeks. Then for bowel habits, so sometimes patient may get constipation, it's quite common, and it may cause backache and abdominal discomfort. So you ensure a patient that she should take regular fluid, plenty fluids, take vegetables that are rich in fiber and milk, or sometimes you might have to prescribe stool softeners at bedtime, okay? Then bathing. So bathing, patient can take daily bath, but they need to be careful against sleeping in the bathroom due to imbalance, okay? And they need to avoid douching. Then for clothing, they need to ensure they wear loose but comfortable garments, okay? They need to try and avoid high heel shoes in advanced pregnancy, as well as they need to try and avoid constricting belts. So generally coitus, that's not restricted during pregnancy. However, the women that are at increased risk of miscarriage or preterm labor, they should avoid coitus, okay? Then travel, so travel that involve vehicles that may cause jerks, they're better to be avoided, especially in the first trimester and in the last 6 weeks of pregnancy. Smoking and alcohol. This one, they need to avoid smoking and they need to avoid taking alcohol, okay? Then immunization, usually we give tetanus toxoid. Others live immunization is being avoided in pregnancy, such as rubella vaccine, all this should be avoided. Then about the drugs, almost all the drugs that are given to the mother are able to cross the placenta to reach the fetus, okay? So generally we need to ensure that the drugs we're giving are not harmful to the fetus. So this is basically a summary of antenatal or prenatal care. So history taking, thorough clinical examination, then under investigation, you do the routine and special investigations. Special investigations depend on the patient, okay? Then at first you need to advise them on the diet, that is to avoid constipation, hygiene, and specific to any problem that the patient presents with. So subsequent visits, so this should be every 4 weeks until 28 weeks, then every 2 weeks until 36 weeks, and weekly thereafter. Under maternal health, you need to ensure you check the weight, BP, pulse, symptom analysis, and any other abnormalities. Then fetal health, check for fetal growth, fundal height, fetal heart rate, amniotic fluid volume, presentation, and fetal activity. Then couple education and preparation for childbirth. The reference was DC Obstetrics. Thank you for watching.